Thanks so much for joining us. We're just going to give people another few minutes. Okay, welcome everyone. Thanks so much for being here today. I'm Lindsay Goldman, CEO of Grantmakers in Aging. We are a membership association working to mobilize financial, social, and intellectual capital to improve the experience of aging now and in the future. Today, we're talking about multi-sector plans for aging, sometimes known as master plans or strategic plans. These plans serve as blueprints for government action and investment across sectors. They can help us to harness the opportunities associated with an aging population to address emerging needs and to reduce longstanding inequities. Across the United States, multi-sector plans for aging are rapidly proliferating, and globally, about 128 countries have national or subnational plans on aging. So today's conversation will center around planning efforts worldwide, philanthropy's role in catalyzing multi-sector plans, and the feasibility of a national US plan for aging. And we have such a fabulous panel joining us today for this conversation. Alana Officer is the unit head for demographic change and healthy aging for the World Health Organization. Alana is joining us in the middle of her dinner time, so we greatly appreciate her participation. We also have Vijeth Iyengar, Director of Global Aging in the Office of International Affairs of AARP, and Peter Kaldes, President and CEO of the American Society on Aging. Today's webinar is supported by the SCAN Foundation, West Health, and the John A. Hartford Foundation, and is co-sponsored by Grantmakers in Health. We will be making today's presentation available to anyone who wishes to view it later, so there's no need to take copious notes, and the slides and audio will all be included. So watch for an email to be sent within a few days. We invite you to ask questions during the conversation by typing them into the question box, and we will address all of the questions at the end of the webinar. And now I'm going to turn it over to Alana Officer. Alana?
Thanks, Lindsay. So good evening, good afternoon, good morning, depending on where you are. It's fantastic to be here. So I'm going to tell you a little bit about the United Nations Decade of Healthy Aging. So in 2020, the United Nations General Assembly declared 2021 to 2030 the Decade of Healthy Aging. And this decade is really intended to sort of spur collective action that can foster both longer and healthier lives, in effect to improve the lives of older people, their families, and their communities around the world. So the decade is really connected to other agendas that you no doubt know about in terms of the Sustainable Development Goals, but also in terms of the Madrid International Plan of Action on Aging. I'm going to ask Alice, who's kindly going to show you a very short film, which just gives you a sense of the decade and what we're trying to achieve. So I'm going to pass over to Alice. Everything. Yeah.
When it comes to aging, we can learn a lot from nature. Consider a tree. As it grows, its rings expand outwards, telling the years gone by. But those rings tell more than just time. If you look between the lines, you will also see how the tree's habitat and living conditions have impacted its life. The healthier the ecosystem, the more it will have thrived. We humans are no different. As we age, our physical and social environment provide us with vital resources. Access to healthcare and proper nutrition, opportunities in education and employment. Safe housing and supportive communities become the roots that nourish our development and well-being. So what happens when we grow older if our environment does not sustain us? Just like a tree, our health declines and we struggle to flourish. Over time, we may become disconnected and a burden to others. The UN Decade of Healthy Aging aims to give everyone the opportunity to add life to years, wherever they may live. A transformative collaboration of diverse sectors and organizations, the decade focuses on changing how we think, feel, and act towards aging, cultivating age-friendly environments, creating responsive healthcare systems and services, and promoting long-term care and support essential to living with meaning and dignity. By adding quality to quantity, we give all people the chance to lead a meaningful life, no matter their age. And that includes you, and you, and you, and me. Together, we can make every year count, not by the numbers, but how we live and grow in between.
Thanks, Alice. That was fantastic. So, in terms of the decade, we have a really comprehensive global plan. We're going to talk about national multisectoral plans in a minute, but we have a global plan, which the team will post in the chat for you, which has been adopted by countries. And they decided that based on the needs, that there were 4 priority areas that the world needed to focus on and need to be covered in plans. Changing how we think, feel, and act towards aging or tackling ageism, building communities that are better places in which to grow older, ensuring that the healthcare that's provided is integrated, and that our primary healthcare services are really responsive to the needs of older people, and ensuring that older people who need it, who experience declines in physical and mental capacity, get the support that they need for long-term care. But it was also decided that to be successful in achieving these actions, we needed to focus on sort of 4 enablers, making sure that, and these are really relevant also in terms of national and multisectoral planning, we needed to make sure that we can hear the voice and we can meaningfully engage older people, their families, and their communities in all decisions that affect their lives. We need to nurture leadership and we need to build capacity to be able to drive action. We need to connect different stakeholders around the world to share and to learn experience. And we need to really strengthen our data research and innovation if we're going to accelerate implementation. So I want to focus a bit more on the leadership issue, because if there's not national level leadership, then you don't generally get multisectoral plans on aging. And every single country in the world needs a consolidated vision of how they're going to improve the well-being of older people within their countries. And clearly these national plans provide an umbrella and a vision which also needs to be specific sectoral plans, whether we're talking about health or care or transportation, urban planning, social protection. So in 2020, when we asked countries, did they have a national multisectoral plan that aligns with the decade? In fact, 105 countries said yes, which was 17 more than 2 years before. So there is an increasing trend, as Lindsay said, for countries to adopt national plans. And also, it's really important that the process, because in effect, the process of developing and implementing is more important than that paper. But the process of developing national plans really needs to bring together broad sectors, but also stakeholders. And that's really the essence of the decade as well. Governments, civil society, academics, professionals, private sector, and philanthropy need to come together to really drive action in countries. And about 102 countries in 2020, when we started the decade and we looked at the baseline data, already had these sort of fora. But obviously plans can't be done in a vacuum. So they need to be informed by a situation analysis, which looks at the numbers of older people, current health status, care needs, socioeconomic status, what's happening in the social and physical environment, how effective our existing services are and where the gaps are. And obviously this requires disaggregated data. And many countries do not have adequate disaggregated data to be able to inform their national planning. And this is really important. We just set up an aging portal for the decade, which brings together all the data that we can find for 194 countries on a range of indicators that also support countries in terms of their national planning. And it's really important as they go forward. You can't do everything within a national plan at a particular time. So it's important that countries prioritize and that they determine measurable outcomes to be able to report and show success in terms of those plans. But maybe another key point I think I wanted to make was that unfortunately these plans, they don't implement themselves. So it's really important to be clear in this process. And it's one of the things that we work on as well, is who's responsible for the coordination, who actually does take decisions, what's the process for monitoring, the process for reporting, and who holds the purse strings and can take decisions around resources. And one of the areas when we ask countries, do you actually have somebody who's responsible for the work on aging in country? 22 countries out of 194 didn't. So if it's not clear who's responsible within the country for taking this action forward, that piece of paper is unlikely to be implemented. We've just we have a multilingual knowledge exchange platform, and there's a new section there where we're consolidating plans really so that we can share those between countries. But much more specific analysis of those plans, which Vijeth's going to talk to, is also incredibly helpful. And lastly, a policy that people don't know about, mechanisms where they can't hold their governments to account, in fact, doesn't have any teeth and is unlikely to drive results. So being able to communicate around those national policies is really important. So the decade provides us really with an unprecedented opportunity to add life to years, and national plans are really important for every single country in the world to be able to communicate the vision that they have for transforming their country to be a better place in which to live and to age. And certainly, I mean, it's fantastic to be on this meeting. Philanthropy has such an important role in all of the areas of multi-sectoral plan development. So great to be part of the conversation. And I think it's over to Vijeth, who's going to tell you a bit more about the work they've been doing. Thank you very much.
Thank you, Alana. First, my thanks to Lindsay for your continued leadership in this topical area. I also want to take this moment to thank Grantmakers in Aging, Grantmakers in Health, as well as the SCAN Foundation, West Health, and the John A. Hartford Foundation for their continued support of this webinar series. It's a real pleasure to join this conversation with my fellow panelists. The webinar comes at an incredibly transformational time with several significant global efforts underway to address the needs, services, and supports of older adults and their families everywhere. Some of these global efforts include the UN Decade of Healthy Aging, which was covered by Alana, the WHO Global Campaign to Combat Ageism, an initiative supported by 194 member states of the WHO to change the narrative around aging and to help create a more just world. And finally, the celebration of 20 years since the inception of the Madrid International Plan of Action on Aging, otherwise known as MIPA, the first global agreement recognizing older people as contributors to the development of societies. Throughout the world, we're witnessing a seismic demographic shift in which all societies are in the midst of what the UN has called the longevity revolution. For example, according to the WHO, by 2030, just 7 years or so from now, 1.4 billion people will be aged 60 years or older, compared to 1 billion as of 2019. Considering virtually every country in the world is experiencing growth in the size and proportion of their older persons, it is imperative to understand the successes, challenges, and emerging practices occurring globally. Now, while many on this webinar are familiar with AARP's domestic-facing work, AARP and global might be a foreign, no pun intended, relationship to some on this webinar. What we do for one, we do for all is a widely quoted saying in the corridors of AARP and from our founder, Dr. Ethel Percy-Andres. And it sums up our efforts with the notion that we work on behalf of older adults everywhere, members and non-members alike. We believe that good ideas have no borders and work to both identify innovations and promising practices from abroad and bring them back to the US via advocacy and policy exchanges such as the one on this webinar. Thanks to Ethel's vision, AARP has been involved internationally for nearly 5 decades, serving as a trailblazer for global aging efforts. Moreover, in striving to be an international leader, AARP is committed to a partnership approach, putting a high priority in connecting and convening like-minded stakeholders from around the world who are working to support the health, financial security, and overall well-being of older persons. It's with this in mind that we embarked on a partnership with Foreign Policy Analytics, or FP Analytics, to conduct an analysis of publicly available national and subnational plans of action on aging across the world. As demographic shifts place further fiscal pressures on social protection and health systems, proactive and forward-thinking policies are necessary to ensure that every person can age equitably with security and dignity. Countries will need to strategically integrate an understanding of and responsiveness to aging across a range of policy areas at every level of government, both at the federal level or national level and at the county level. To understand the varying approaches to healthy aging more deeply and to advance more comprehensive, inclusive, whole of government approaches to aging, the Database of Action Plans on Aging, or DAPA, was launched by AARP in conjunction with FP Analytics in 2022. The database highlights features of plans, the context in which they were developed, and achievements to date. The database and corresponding analysis were intended to provide policymakers and healthy aging experts around the world with resources to inform the development or updating of policies and plans intended to support their aging populations. In this first wave of the DAPA in 2022, we analyzed and evaluated an initial sample of plans from 13 countries and 2 subnational jurisdictions. National plans were drawn from Malawi, from Argentina, Chile, and Uruguay, from Jordan and Lebanon, from Bulgaria, Ireland, and Malta, from Nepal, and from Cambodia, New Zealand, and Singapore. Subnational plans were drawn from California and Wales. Now you might be thinking why we chose this initial set of 15. Selections were prioritized and based on geographic diversity, levels of economic development, representation from the 6 WHO regions, and from the 5 United Nations regional commissions. Importantly, the plans, policies, and strategies were measured against 19 key areas that were found in both the Madrid International Plan of Action on Aging, or MIPA, across its 3 pillars, and across the 4 action areas of the UN Decade of Healthy Aging that Alana just covered. There were many insights that were gleaned from our analysis of those action plans measured against those global frameworks, but I'd like to service a subset of those in the interest of time. A quick caveat that we were really at the mercy of publicly available information, and so insights and judgments reflect that reality. When accounting for the key themes and action areas of the MIPA and the UN Decade, Argentina, Cambodia, Ireland, and Lebanon, and Uruguay, those 5 countries were found to have the most comprehensive plans of those evaluated. These plans were both broad, covering many types of issues that can impact health, enabling environments, and development outcomes of older persons. But more importantly, they were robust. Each policy issue area included at least one actionable, measurable objective and associated funding. Across the 15 plans reviewed in this initial wave, there were additionally two nearly universal themes that shone through. One was that action plans incorporated policies and budgets in terms of preventing neglect, abuse, and violence. And number two, improving or providing integrated healthcare for older persons. This is quite promising, given that according to a 2021 WHO Global Report on Ageism, roughly half of the world's population holds ageist attitudes. Further encouraging, 13 of the 15 plans evaluated included concrete targets around improving older persons' financial security and other social protections, including providing education and training and building intergenerational solidarity. So what does this look like? For example, Bulgaria's plan, entitled the National Comprehensive Strategy for Active Aging, which runs through 2016 to 2030, has a heavy emphasis on employment, retraining and retaining older adults in the workforce, as the country will soon experience the world's steepest decline in the working age population. Continuing along this theme of workforce, as it pertains to bolstering the healthcare workforce, 12 out of the 15 plans analyzed included targets to train care providers and healthcare professionals and prevent non-communicable diseases. Other aspects of national plans were also present across many countries. Going back to the MIPA, the global instrument that's celebrating its 20 years on since its inception in 2002. The third pillar of that global instrument corresponded to the fourth action area of the UN decade, which all in all emphasizes the promotion of enabling and supportive environments, otherwise known as age-friendly cities and communities. We found from an analysis that 13 out of the 15 plans identified improving housing availability, quality, and affordability, as well as expanding older persons' access to transport and public spaces. New Zealand's Better Late Life Strategy, which runs from 2019 to 2034, identifies specifically the creation of functional, safe, and affordable housing for older people, with a particular emphasis on providing an option for older persons to remain independent and age in place in their communities. While the MIPA and UN Decade Global Frameworks provide important indicators against which to benchmark plans, we identified 4 additional areas from our initial analysis of these 15 plans where future plans and future development and revision of policies should consider. Number 1, plans should solicit and incorporate older adults' perspectives to ensure effective, inclusive strategies. Several jurisdictions, including Argentina, the state of California, Ireland, Malta, and Wales, constantly consulted experts and civil society organizations throughout the process. It led to a more comprehensive, robust plan. Number 2, plans should invest in adequate monitoring and resourcing of their goals. Many of you are part of private funders or private families, foundations or philanthropy organizations where you look at impact investment, where you look at measurable outcomes. A lot of these plans in the future should invest in this adequate monitoring and resourcing of their goals, specifically ensuring a budget for the plan's implementation and for its subsequent success. Number 3, plans must incorporate lessons learned from the ongoing COVID-19 pandemic. Plans developed after the onset of the pandemic have incorporated these lessons. For example, going back to New Zealand, their plan addresses the impacts of pandemic on loneliness and social isolation, digital inclusion, working older adults, and housing. And lastly, plans must make more explicit their goals to enhance equity and reduce disparities. A prime example of this from our analysis included Ireland's positive aging strategy, which includes 14 indicators on healthy aging for Irish travelers, a nomadic ethnocultural group that has traditionally faced political and social discrimination and exclusion. At this point in time, a natural question could be, this is all great. You've thrown a bunch of numbers at us, thrown a bunch of plans at us. Why should my particular organization care? How should we be invested? Why should we care about multi-sector plans on aging? In terms of the why, these multi-sector plans of action hold great promise in harnessing the full societal contributions of an aging population. And these contributions from older adults are not minor. Colleagues of mine at AARP have done some great work in terms of fleshing out and uncovering those contributions from the 50+ population. And they found in a recent global longevity economy report that the 50+ population already accounted for half of global consumer spending, accounting for $35 trillion in 2020, and by 2050, this figure reaching nearly 60% or $96 trillion. Moreover, through spending on goods and services, the 50+ population supported 1/3 of the world's jobs in 2020, totaling $23 trillion in labor income. So these multi-sector plans hold great promise in terms of catalyzing these contributions of our older members of society throughout their life. There's a critical role that non-state actors such as private funders and philanthropy have in the design, development, and implementation of these plans, and ensuring that these plans are indeed successful via measurable outcomes and goals. You're part of the community of stakeholders that are critical to ensure progress is measured, gaps are filled, and opportunities are met. In closing, developing a national plan is a key opportunity for countries, especially those facing a major demographic shift, to plan for aging populations and in turn improve the health and well-being of their older persons. As the global community reflects on ways amid the pandemic and beyond to build more sustainable, inclusive, equitable, and robust systems of care and healthcare delivery, governments at the country and county level have a renewed opportunity to ensure that no older adult is left behind in their desire to lead healthy and active lives as they age. There has been some links to the AARP international work in the chat. Certainly encourage folks to take a visit and reach out to us. We'd love for you to stay engaged with our work and vice versa. I thank you for this opportunity and look forward to the discussion. I now yield the floor to Peter Kaldes of the American Society on Aging. Peter.
Thank you, Vijeth. I am Peter Kaldes with the American Society on Aging. I want to talk to you a little bit about the ASA, and then talk to you a little bit about why we need a federal plan on aging in the United States, and then how philanthropy can catalyze that effort. So since 1954, ASA has developed and led the largest, most diverse community of professionals working in aging in America. As a result, ASA has become the go-to source to cultivate leadership, advance knowledge, and strengthen the skills of our members and others who work with and on behalf of older adults. I'd like to say we're the largest club of influencers in aging in America. So I want to thank all of you for participating, including, I know, some of our ASA members that are on this webinar. So unlike many of the country's efforts we just heard about, the US does not have a federal plan on aging. When it comes to federal policy on aging, the political platforms of Democrats and Republicans, which typically inform the policy priorities of administrations, haven't changed significantly in the last 20 years. While Social Security and Medicare are important, they tend to be the exclusive focus of elected leaders' efforts, which wrongly assumes the homogeneity of older adults. And if you look at Congress and the bills introduced and rarely passed related to aging, over 75% of these are related to healthcare. Again, important, but ignore other social and economic issues. The federal government needs a broader look at all policies that address the modern and diverse needs of older adults, and that's where MPAs come in. Now, imagine if in addition to ensuring healthy lifespans, our federal government coordinated the entire executive branch, not just HHS or CMS, to put a plan together that could, among other things, create jobs for older adults, advance age-friendly tax policies, expand justice for older adults. So let me give you just some examples of the policies that a federal MPA could address. When it costs $1 million to retire by age 65, and 21% of Americans have no savings, older adults want and need jobs. But it's young people who are singled out as beneficiaries of policies that support opportunity and promise, particularly in education, entrepreneurialism, and job training. It's clearly ageist to ignore older adults in such policies, especially when you consider the popularity of lifelong learning, that middle-aged entrepreneurs are the most successful, and that unemployment levels of those older than age 55 has increased. So imagine if we expanded grant funding to higher education to be more intentional in attracting older adult students and catalyzing the value of intergenerational learning. We could deploy powerful economic development tools, such as those at the US Small Business Administration, the Department of Commerce, to launch and increase investment in age-focused incubators and accelerators that create new business opportunities with universal design in mind. And while we have some federal job retraining programs, they must be improved to ensure older adults have the skills needed in a modern workplace. But these programs won't have any impact if employers continue to discriminate against the hiring of older workers. While mandatory retirement due to age is generally illegal, 56% of workers older than age 50 are forced to leave jobs before they want to retire. We must change our laws to make it possible to prove age discrimination cases, no matter how old you are. Imagine if our government proposed tweaks to tax policies that would benefit older adults. In 2021, half of all older adults had less than $27,000 in yearly income from all sources. With the federal government taxing up to 85% of Social Security payments for older adults, we should eliminate the federal income tax for low-income older adults. If you can afford individual long-term care insurance, not only should you be able to deduct these premiums, but you should also earn exemptions for being a member of a multi-generational household or being a caregiver. What if we incentivize the business community to encourage to invest in older adults with tax incentives to retain older workers and create a multi-generational workforce, to ensure affordable senior housing, and to provide caregiving tools through employee assistance programs? More corporate philanthropy can be unleashed by raising the cap on charitable giving, enhancing the Community Reinvestment Act to provide greater credits for financial institutions to invest in age-friendly supports. Now, while funding for many of our community-based services for older adults currently comes from the Older Americans Act, we should also support local community efforts to create special taxing districts to raise revenue that will support meeting far more older adults' needs the way we do with children's services. We also need to address the inequities of historically marginalized older adults, such as people of color and LGBTQ+ elders, increasing income supports, creating accessible housing through unique public funding programs, and expand legal services to combat the rising homelessness of older adults. Homelessness in elders is predicted to be more than double by 2050, from more than 44,000 in 2010 to nearly 93,000 people in 2050. And as we come out of COVID, we need a national framework for administering healthcare during future pandemics or other public health crises, so as to avoid exclusion criteria that would ration healthcare based on age. Finally, imagine older adults right now who are regularly blamed for having contributed to global warming and climate change. Imagine if we gave them and reminded them of the agency that they have, whether economically or through voting power, to ensure that efforts and policies are enacted to dramatically alter the course of climate change. Natural disasters such as fires, floods, adversely impact older adults at a higher rate, all of which could be prevented with more comprehensive disaster preparedness plans, as well as an accelerated climate change action plan. So as you can tell, we at the ASA have lots of ideas for what a federal MPA would look like. And simply put, a carefully constructed MPA would expand our current limited aging policies. Most of our aging policies are currently siloed, like I said, in ASL or CMS. They do amazing work, but they have legal restrictions and a limited scope in their jurisdiction to tackle all that needs to happen. That is why we need a federal plan on aging. And to be sure, we can do it now. It is entirely feasible. In the Obama White House, I ran a federal-wide plan to boost exports. I know it can be done. The President of the United States could, with as much as an executive order or as little as standing up a new interagency committee, get this done today. Susan Rice, who currently runs point on all domestic policies for the Biden administration, could add someone on her team to bring together all relevant agencies to advance a plan and execute against it. But despite our advocacy for it, it's not happening. So I'm glad to see states are showing how it's done. And this is where while we wait for federal governments to act, At Grantmakers, you have an important role to catalyze multi-sector plans at the state or local level. This sort of multi-stakeholder planning with intentional efforts from business, government, and nonprofits happens in other sectors, such as in education or in economic development. The time is now to create a holistic plan that we can all execute to tackle the universe of issues to make sure we have the systems in place to support aging in this country. So, for philanthropy, here's 3 ways you can get involved. First, fund a learning collaborative. The Multisector Plan for Aging Learning Collaborative currently exists. It's led by the Center for Healthcare Strategies. It's a learning community that is helping states advance their MPAs. It's made possible through support from the SCAN Foundation, West Health, and the May and Stanley Smith Charitable Trust. It's a 12-month collaborative, and it's supporting 10 states: Colorado, Illinois, Indiana, Minnesota, North Carolina, North Dakota, Oregon, South Carolina, Tennessee, and Vermont. It builds on work already underway in their states. And the collaborative is providing peer-to-peer exchange that fosters the sharing of best practices and lessons, access to a network of experts, including those who have helped advance MPAs in other states, and technical assistance to support buy-in for an MPA across stakeholders in their states. Now, the leaders vary by state. So for example, in Colorado, it's the governor's office, it's their Department of Human Services and others that are at the helm. In North Carolina, it's their Division of Aging and Adult Services and their Division of Health Benefits, or their Medicaid. In Tennessee, for example, it's TennCare, which is their Tennessee Medicaid, the governor's office, and several other stakeholders. If you want to learn more about it, we'll put a link in the chat. A second way that philanthropy can get engaged is to support national or regional convenings with year-round thought leadership. For example, in less than 2 weeks, the ASA is hosting a national symposium to build on the MPA momentum. The ASA recognizes that successfully launching a multi-stakeholder statewide planning process on aging in particular is no small feat. But we believe if we use our longstanding convening authority to bring together ASA members who have successfully launched MPAs, we will catalyze and inspire others to act. Over half of all states are implementing or planning to implement comprehensive MPA activities. And this project is precisely the type of effort that is expected of a multidisciplinary association such as the ASA, or even a state or local convener in aging. We think this level of engagement will undoubtedly inspire future federal action. So thanks to the John A. Hartford Foundation, the SCAN Foundation, and West Health, our project includes a symposium at our annual conference on aging, which is designed for attendees who are either already engaged in an MPA or have some baseline understanding of it. Our work also includes year-round thought leadership to inspire those working in this area with carefully crafted content for ACL's No Wrong Door awardees, for businesses, for various levels of government, older adults, people with disabilities, family caregivers, and funders. Now, I know some funders aren't as comfortable funding convenings and thought leadership because their impact may not seem as immediately obvious, but you're the key to changing the minds of leaders and building momentum. You can have grantees track impact metrics like readership and engagement with year-round educational and published activities. You can require an analysis of whether attendees and readers find such work either applicable to their own efforts and require a report back on what actions or partnerships developed as a result of this project. You can track just how many MPAs you catalyzed. And there's still time to join us at our annual conference, which I know is the second largest convening of GIA members after GIA's own conference, and we'll pop the link to register in the chat. Finally, we think philanthropy can fund educational and advocacy campaigns. Now, I know that for some of our funder members, this is the least palatable option to support MPAs, but here's the thing. Changing public policy is an expensive proposition for nonprofit advocates. From staffing to policy papers to travel for meetings, many of our ASA members are public policy champions and have earned their policy wins for the field on a shoestring budget, but it takes decades at a time. Meanwhile, when there was a semiconductor shortage during the recent supply chain crisis, businesses mobilized in 1 year to get the CHIPS Act passed. which provided $280 billion with a B dollars in new funding to boost domestic research and manufacturing of semiconductors. I'm not saying semiconductors aren't important, but when you compare $280 billion to the Older Americans Act, which provides only $2 billion in supports, you can understand why we need more help proving our case to federal policymakers. Imagine what we could do in aging with that funding. Now, all is not lost, though, with the CHIPS Act. The Biden administration is requiring certain semiconductor manufacturers that apply for subsidies under the CHIPS Act to submit plans to provide their workers with access to affordable, accessible, reliable, and high-quality childcare. This requirement is expected to cover fewer than 200,000 workers, but it is a novel way to use national defense and economic subsidies to invest in an inclusive, family-friendly workforce. And why did that happen? Nonprofit advocates. They worked tirelessly on a shoestring budget to convince the administration that childcare was important. Imagine if the CHIPS Act also included elder care. I'm not suggesting you pay for lobbying, which would be beyond your legal authority. But what I am saying is if we're going to build a national plan on aging to prepare this country for the demographic shifts we're seeing, we need your help funding advocacy and educational efforts on aging. Thank you for having me. Lindsay, back to you.
Thanks so much, Peter. And I'm going to ask all of our speakers to turn their cameras on again, and we're going to get to the Q&A, the most interesting part of the discussion. So please, if you have questions, feel free to type them into the chat. We've gotten a few of them. So actually, Peter, I'm going to stick with you for a minute. Somebody's asking about the White House Conference on Aging and whether, when the conference is convened, hopefully in 2025 or maybe before, could a task force be convened to begin developing a national plan? And related to that, there's this Federal Interagency Coordinating Council on Aging that's referenced in the Older Americans Act. And for many of us who've been working for years and years, trying to see some action at a federal level, it was really exciting to see that for the first time ever in 2023, there is $1 million appropriation. So do you see this as an opportunity to advance a federal MPA? What do you think?
Yeah, so it's actually a great history. The ASA was at the first White House conference in the 60s and has been at every single one ever since. There's extraordinary value to bringing together stakeholders. I wish it was more frequently than every decade, but bringing together stakeholders to plan for all the aging issues that we have to confront. So I would say to the person asking the question, absolutely, a task force could be set up tomorrow to figure this out and to find the appropriate time to do it. Now, there are a lot of constraints, as you can imagine, both political, process, and funding. It's not free to host one of these things. And related, the OAA, the interagency committee that's set up by that law, is a fantastic first step. My concern with it, though, is that it's limiting on its face. In other words, that committee will probably only address issues addressed by the OAA, which, as all of us know, is access to services, nutrition, home and community-based services, disease prevention, health promotion, vulnerable elder rights. It sounds like a lot, and candidly, it really is. But there are so many more social and economic issues that we need to tackle.
There's got to be more to life than a visit from a social worker every 6 months when I'm 85.
Bingo, bingo.
Thanks, that's helpful. And so, related to what you're saying, Alana and Vijeth, you both talked about the importance of leadership and accountability, right? And so I'm curious to know if, as we're saying in the US, we don't want to further silo and segregate aging, right? And to only look at the healthcare and social service needs of older people. Where do you see some of the more successful plans? Where do they live within government? Are they in the planning division? Are they in economic development? Are they in aging? Where are they?
I mean, the answer is they're in different places, yeah? And I mean, maybe Vijeth can speak to the examples that he has. But where you get more multi-sectoral action, being in the Prime Minister's office, being in a division basically that has responsibilities across sectors, which isn't pigeonholed necessarily within health or within social welfare, creates the potential to be able to bring those different sectors together. So, and I think that's where we see the most successful ones, the ones that really drive multi-sectoral action. They have to be high and they have to be placed where they can leverage different sectors. The majority of plans are in social welfare or specifically in aging or in health, yeah? And I think that Peter spoke incredibly elegantly to the need to really think across social protection, labor, lifelong learning, you know, broader than some of the more typical topics that people think around in terms of aging. So the answer is placing it in a place where you can leverage different sectors is key to success in terms of multi.
Thank you. Vijeth, anything to add?
Yeah, I mean, I think, plus one to Alana's point, there's a term that is more familiar to the global aging and health audience than it is to the US domestic audience. It's called mainstreaming aging. And we talked about this a bit in our prep call last week, but the idea is that you want non-traditional folks that aren't thinking about aging on a day-to-day basis, whether it be in the private sector or different areas of government, to be able to view their policy prescriptions, their programmatic recommendations, their budget from an aging lens. And if we can take a page out of the playbook from our friends in the gender activist community or even climate change community, I think we'd be successful. So if you think of climate change, it was purely an environmental issue in, say, the 60s. Then it became slowly a renewables innovation issue. Now it's a national security issue, given the advent of environmental migrants. And as such, you have it's a force multiplier of all these communities, whether it be private sector, civil society, academia, government, that are thinking about climate change from different viewpoints, either national security, either environment, or from an innovation perspective. And what I would advocate for is that aging should take a similar page out of that playbook. You should have folks that say the World Bank or IMF that are not thinking about aging in terms of how they deploy capital in low and middle income countries, talk about aging or think about aging. So when they do fund that bridge, they're making sure it's an age-friendly bridge, in addition to a bridge that can be used by folks with different abilities. If we think about innovation, same thing, whether it be venture capital or private funding towards supporting our older adults, they should think about from an aging lens. And so to Peter's point about having domestic policy council think about aging, I think it dovetails with what we're talking about now. You want folks across the government to be thinking about aging at different levels with different lenses, but all towards preserving the ability for older adults to want to be able to age where they want to with dignity and well-being.
So I think we've given some really great examples of, where philanthropy can play a role. And for many Grantmakers in Aging members, they've been investing in age-friendly communities for a long time. And I think a lot of our members are wondering sort of what's the next step? How do we sustain the gains that we've made in some of this more bottom up rather than top down organizing? And so I'm curious, Vijeth, for the country that had particularly robust plans that scored the highest, did they also have, or did you notice similarly robust plans at the local level? And I guess I'm asking more broadly, how do we see age-friendly communities and municipalities intersecting or integrating with national plans?
Yeah, I think that's a good question. I'll speak to your first point, and perhaps either Peter or Alana want to take the latter half of your question. I want to say for the plans, whether it be Uruguay or Argentina, that had really comprehensive plans that were both broad and robust, they were able to bring in NGOs early on. And so one of the 4 recommendations we do have for future plans is ensuring that older adults have a seat at the table, ensuring that NGOs have a seat at the table, ensuring that philanthropy that are funding some of the NGOs that are informing some of the NPAs have a seat at the table, so that all these considerations can be adopted. And so for those plans that were robust and comprehensive, I don't want to say successful or not, because I think those are really touchy words, but for those plans that were inclusive, they were able to bring in different stakeholders early on in the process. So baked into their recommendations, baked into what they included in their plan, it was both culturally sensitive, it made fiscal sense, it was diverse and broad in terms of stakeholder input, and then it was measurable, which, as Peter mentioned, and I also mentioned, philanthropy and private funders are looking for measurable impact. And so those are some of the sort of key ingredients that we were able to suss out from this initial wave of the DAPA database.
And how did some of the more advanced plans, how did they emerge? Was there significant consumer demand mobilized, like what Peter was talking about we really needed to see here in order to galvanize the political will to do something? Or was it driven by government or driven by some other non-state actor? Any trends there?
I'll keep this very brief so I don't take up the majority of time talking. I think it was, and we're butting up against this too, right? There are certain regions of the world that are experiencing a youth bulge, and where making a case for investing in older adults is really difficult. And so for example, Africa, right? And so they have a hard time, in our view, in terms of understanding the value add of an MPA. There are certain regions, say Uruguay, South America, Western Europe, where having an MPA makes great sense, right? Because of the demographic shifts. And so I would say that you need both top-down and bottom-up support. But one thing throughout is, and Peter alluded to this as well, you need sustained political will. If you have that top-down support, getting stuff done is a lot easier.
Anything to add, Peter or Alana?
I might jump in on the question that I think Brad asked in the chat and that you picked up on, and the idea that MPAs are really at the heart of age-friendly cities and communities, yeah? And that's what, and cities and communities do this work well, yeah? And then the question is, what influence do they have at national level? So what we're seeing is, so we support, obviously, the global network, WHO Global Network for Age-Friendly Cities and Communities, which covers about 1,500 cities and communities in 52 countries. And where we see that cities and communities can leverage the work that they do is when there's a national program. So where there is an opportunity at national level to convene and to leverage local experience and local action. So where there is just independent, at least in our experience around the world, MPAs at local level, and there's no connection to national level infrastructure, they're not leveraged in the same way that they could be, when there is a national program. So in effect, WHO will release next month a new guide on developing national programs on age-friendly cities and communities, which in effect enable the link between local and national to ensure that, those links are actually made and we can leverage more work that's happening within local cities and communities around the world.
And Alana, just to pick up on that, there's a question in the chat about the age-friendly communities assessment process. And is there an effort to augment or revise the assessment to be more focused on strengths and perhaps less focused on needs?
Great question. So at the moment, it is a priority in terms of looking at revised assessment. What we're doing at the moment is working at national level, because we recognize that, in fact, if there are not national programs, then the sustainability of age-friendly action is quite limited. And also that cities and communities can't learn from each other, in the work that they're doing, which already is happening a lot through the support from AARP in terms of the livable city. So the first process for us is really about building national programs around the world. Our focus is really on low and middle income countries. If you look at the age-friendly world and you look at the map of the world, we've got the fastest demographic shifts happening in Africa, and we've got no age-friendly cities and communities. So there's a real need to build capacity in low and middle income countries to be able to better address the needs of all the people. So that's it. The next area is we're looking at the intervention. So what actually works in age-friendly cities and communities, in ensuring mobility and building and maintaining relationships, and meeting people's basic needs, and enabling older people to contribute in a very broad perspective. What, in a strength-based approach, what interventions work, and cities and communities, what should they be investing in? So rather than maybe a checklist of ideas, we need to understand what's the evidence around effectiveness. So that's really the next strategy for us going forward. So, and that's really based on a strength-based, and how to support older people, and I think, both Vijeth and Peter spoke to this, really how to address a much more comprehensive approach in terms of enabling older people to continue to do what it is that they value and continue to contribute within their communities and cities.
Thank you. So we're really running out of time, but I do want to raise one question that's been posed in the chat, even though I know we're not going to have time to really address it in the way that we should. But the question is, how do national plans meet the needs of rural populations? So where's their potential to reduce some of the inequities that we see with rural older people? Anyone want to comment on that?
Yeah, let me jump in on that one. I think tying it to some of the other responses, I think there were some really fantastic examples of local communities coming together to create real age-friendly communities. And what I mean by that is stakeholders from across local government, local business, local academia have come together to inform a plan. That is fantastic. Here's the rub. The rub is sometimes that plan either does or does not include the local area agency on aging. And as you know, the local area agency on aging gets its power and money from the state unit on aging, and the state unit on aging gets its resources from the ACL. Now I bring it from AOA. Now I bring this up because that is the silo that gets created when at the ground level, at the local level, it's really expansive. So the best way to get rural supports is for the state itself to get involved and ensure that all of its geographies are either age-friendly or fall under an MPA. And I think the California example is a really good one. I think New York has a lot of opportunity there as well. And obviously Tennessee and some other states that have very large rural communities have to necessarily think about this.
Well, thank you so much for this really important conversation. We are getting to the end of our hour. So I want to just remind all of you that if you are going to the American Society on Aging conference at the end of this month, there will be lots of multi-sector plan content, as well as a meeting for funders. GIA will soon release a new funders issue brief focused on multi-sector plans. I really want to thank Alana, Peter, and Vijeth for sharing your expertise with us today. I want to thank the SCAN Foundation, West Health, and the John A. Hartford Foundation for supporting this webinar, and Grantmakers in Health for partnering with us. As a reminder, we will be making today's presentation available to anyone who wants to view it later, including slides and audio. So watch for an email to be sent within a few days. Please follow us on social media. Please complete the brief survey that you'll receive right after the program to help us improve. And please join us for our next conversation on April 11th on accelerating healthy aging for all through impact investing. More information can be found on our website. Thanks so much for being with us today, and be well.